Hi, this is Dr. Victor bringing you interesting highlights of ESC Heart Failure 2021, which is AFFIRM-AHF-based multinational cost effectiveness analysis of intravenous ferric carboxymaltose for treatment of iron deficiency in an acute heart failure setting. Heart failure utilizes major resources and is an economic burden on healthcare system. Iron deficiency is prevalent in 50% patients with chronic heart failure and in 80% patients hospitalized for acute heart failure. It is associated with poor functional status and increased risk of adverse outcome in heart failure patients. Thus, iron deficiency in heart failure is an area of significant unmet need. In a AFFIRM-AHF trial, patients hospitalized for acute heart failure with left ejection fraction of less than 50% having iron deficiency and hemoglobin level between 8 to 15 gram per dl were randomized to either placebo or ferric carboxymaltose treatment and followed periodically for 52 weeks. The primary outcome was composite of hospitalization for heart failure and CV death, and secondary outcomes were total heart failure hospitalization, CV death, and most importantly, change from baseline in Kansas City Cardiomyopathy Questionnaire with clinical summary score. The outcome analysis showed that the primary composite endpoint was not met with significant value of less than 5%, but the total heart failure hospitalization events were significantly reduced with p-value of 0.013 and risk reduction of 11 events per 100 patient years. The Kansas City score at baseline was 40 and significant improvement was seen between 4th and 24th week compared to placebo. If you look at the cost-effective analysis, ferric carboxy maltose therapy was associated with dominant cost saving with additional health gains in UK, USA and Switzerland. This treatment was highly cost effective in Italy considering its less population with high treatment cost. Overall, the cost effectiveness results were driven with reduced hospitalization for heart failure events and quality of life gains. This study thus concluded that ferric carboxymaltose treatment of iron deficiency in patients admitted with acute heart failure was estimated to be cost saving relative to placebo in UK, USA and Switzerland and cost effective in Italy. The cost offset were largely attributable to reduction in heart failure events seen in trial. Subgroup analysis and probabilistic and deterministic sensitivity analysis demonstrated the cost effectiveness results were consistent and robust. Thus, this treatment with ferric carboxymaltose demonstrated to be well tolerated, effective, and of good value in patients admitted with acute care. Thank you.